Hey everyone! If you've been following Proof's Instagram like I have, you might have heard that FASD is the most common preventable birth defect in the US. It affects about 1 in 20 children, and it can happen for a lot of different reasons. But sometimes it happens because people drink before they know they're pregnant. If we consider the fact that nearly half of the pregnancies in the US are unplanned, we can see how pregnancy prevention really goes hand in hand with FASD prevention, which is where I come in. My name is Logan, and I'm a sex educator with the SELF program at Lutheran Social Service. I work mostly with youth now, but I've talked about pregnancy prevention with folks of all ages, and I'm really excited to be here to talk to you all about it today. So during this video, I'm going to talk about 3 main things. The first are some really awesome, effective birth control methods. The second are where you can go in Minnesota, or mostly the Twin Cities, to get birth control, and how you can go about getting those methods for free. Because even though all of these methods cost less than, for example, a pregnancy or a child, some of these methods can get pretty pricey, and you don't have to pay full price for them for the most part if you live in Minnesota, which is really cool. So I'm going to start by talking about some birth control methods. Before I get into it, I want to offer a little caveat, which is that every person's body is different. Meaning, you might have a friend who has really awesome experiences with one form of birth control. You might try it and hate it. On the flip, you might have a birth control that you love and works really well for you, and your friend might not like it at all. And that's okay. That's one of the reasons why I'm talking about so many methods, is because all of them are reversible, which means that if you don't like them, you can just stop using them, and you can play around until you find the one that works best for you. Because people want different things out of their birth control, and there's a lot of different types of birth control to choose from. So the first one I'm going to talk about today is the implant. I don't know how well you can see it, but it is this thin, flexible rod that's sitting in the middle of this card. Low-key, it kind of looks like someone took a piece of a cocktail straw and taped it to a card, but it really is this size and shape, and it's just implanted in the skin of the arm by a medical professional. Once it's in the arm, it's working. It's full of hormones that are released inside the body that can help prevent pregnancy. So the implant can work for up to 4 years. So you go to the doctor or to the clinic one time, they put the implant in, you don't have to do anything else, it's working. And then 4 years later, you would go back, they would take it out, you could put in a new one, you could choose a different form of birth control, or you could just not be on birth control, whatever you would want to do. This method, of the methods that I'm going to talk about, has the best real-world efficacy. So all of the methods that I'm going to be talking about work 99% of the time if used correctly. Some of them have more room for user error, so they work less in real life. This one, in real life, works 99.9% of the time. It works really, really well. It's awesome. And if you get it and 1 year in decide, you know what, I want to become pregnant, totally fine. You can just go back to the clinic, they would remove it, your fertility would come back right away. Or maybe you're one of the people who doesn't like the side effects that come along with this form of birth control. Again, you could get it taken out at any point, and that's totally fine. Some of the positives that people really like with this method is, for a lot of folks, it makes their periods lighter. For some folks, it makes their periods go away altogether, and some people really like that. But if the implant doesn't really seem like it's your style, or you want something that lasts even longer, another great method is an IUD, or intrauterine device. There are a bunch of different kinds of IUDs, and I'm going to talk about a couple of them. But broadly, they're these pieces of plastic that sit inside the uterus. This little pink thing that I have here is meant to represent a uterus. And in fact, it's not entirely different in size than someone's uterus who's never given birth before. We usually approximate that it's about the size of someone's fist. That's pretty similar. And you can see that there's this little piece of plastic that's sitting inside this model uterus, and that's the IUD. This one is wrapped in copper wire. It's either called the copper IUD or Paragard, and it works because copper kills sperm. I don't know who figured that out. I don't know why, but what we do know is that if copper is there, sperm can't be alive, which is really cool. So once this method is inserted, you have to go to a doctor or a healthcare provider, and they put the IUD inside the uterus by going up through the vagina and the cervix. Once it's in, this one, the Paragard, works for up to 12 years. That's wild. It's a great method for someone who knows they do not want to become pregnant anytime soon. This one doesn't have hormones in it, so it will not lighten your period. But some folks really don't like hormones with their birth control. So this method is a really great option for them. Again, just like the implant, you can always take it out if you don't like the way that it's working for you or if you want to become pregnant. Real world efficacy, this one works about 99.7% of the time. And that's because there's a little bit of the possibility for user error. You might be able to see there are these strings that are coming out of this model uterus. These strings would be there in an actual IUD. They come down through the cervix and sit inside the vagina. After a while, they kind of soften up and just kind of curl up around by the cervix, so you don't notice them as much. But if someone has an IUD, all they would need to do is about once a month, they would just need to put a finger inside themselves to check and see if they could still feel these strings. If they feel the strings have moved or they don't feel the strings at all, that would be a time to talk to a doctor, because sometimes these will shift around and won't work as well. So that's kind of the only source of error for IUDs. If someone loves the concept of an IUD, but wants those things that you can get from hormonal birth control, like lighter periods or maybe no periods at all, there are hormonal IUDs. They don't usually come on a keychain, but they do look just like this. So they look really similar to the Paragard, but they just don't have copper on them. You see they have strings as well. Depending on which IUD you get, they can last anywhere from 3 to 7 years. You would just talk to a healthcare provider about which one is the best option for you. So those are kind of my longest term methods that work really, really well. But say someone is like, I don't want to commit for a full 3 years, 4 years, 12 years. I want something that lasts a little bit less long, but it's still longer lasting than something like a birth control pill. Another great recommendation I have is the Depo Shot. I don't have an example of it because all it is a shot that you get once every 3 months. So you would go to your healthcare provider, they would give you the Depo Shot, and you are protected from unplanned pregnancy for 3 months. Real world efficacy for Depo is a little bit less than the ones I talked about, because you have to remember to get your shot on time, you can't be late, you might forget. So in the real world, we see it working about 97% of the time, but if you get your shots on time, it should work 99.9% of the time as well. I think Depo is a really great option for someone who really wants their birth control to be private, because the implant you can feel. The IUDs, you can feel the strings if you're feeling for them. The shot, if for whatever reason you didn't want folks to know you were on birth control, the only person who would know you were using it is your healthcare provider. So that's a really great option for someone who wants privacy. It's unique from the other options that I'm talking about in that it's the only one where your fertility doesn't come back right away once you stop using it. Because it's a dose of hormones that goes into your body that can't be removed, just some people's bodies take a little extra time to process it out. It might take a week, might take a month, might take 3 months. It kind of depends on the person. So say you're like, I love these options, they last a really long time, that seems like it'd be great for someone else, but I want a little bit more control. I want to be interacting with my birth control a little bit more often. I'm going to talk about one more method that would be a great one for you, which is the Nuvaring. Once again, it's just the ring, not this case or the string that it's attached to, but it is this thin, flexible ring that is full of hormones, and it sits inside someone's vagina for 3 weeks at a time. So if someone wanted to use this method, they would put the ring inside their vagina. Once it's in there, their body heat would help release hormones to prevent pregnancy. They wear it for 3 weeks. At the end of the 3 weeks, they take it out, they throw it in the trash. They have a week off where they would have their period. Most people report that periods are lighter and more manageable, but they do come. And then they would put in a new one and the cycle would start again. I think this is a really great first method for people because it's less commitment than something like the birth control pill that you have to take every single day at the same time of day, but less invasive than the other methods that I talked about. So I know I'm focusing on pregnancy prevention today, but I do feel like it's worth noting that none of the methods that I've talked about so far today help prevent sexually transmitted infections or STIs. So if someone isn't sure of their STI status or their partner's STI status, something that would be really important to do is to use condoms. Because condoms are the only form of birth control, aside from just not having sex, that help prevent STIs as well. Plus, if you double up and use one condom with one of these forms of birth control, you're even more protected. So that 99.9% of the time gets even more effective if you use condoms as well, and you're protected from STIs. So I think that's always a really good option. So now we've talked about all of these great forms of birth control, and you might be wondering, where can I get them? Are places even open during the pandemic? Fortunately, reproductive health is considered an essential service, so you can still access these birth control methods from clinics during the COVID-19 pandemic. The only thing that would make things a little bit different is instead of being able to walk into every clinic, you might have to just make an appointment in advance. But that's really the biggest change. And fortunately, in the Twin Cities, we have a lot of really awesome clinics that you can go to. In St. Paul, we have Family Tree Clinic. In downtown Minneapolis, we have Red Door Clinic. In the northwest suburbs, we have Annex Teen Clinic. And we have multiple locations of Planned Parenthood all throughout the Twin Cities. Not only can you use those clinics to get these forms of birth control, but if you ever have questions that you would want to talk through with a provider, they can help you decide which method to use as well, because these clinics are really education focused in addition to being focused on reproductive health, which I think is really, really cool. So that brings us to the last point, which is, how do I get these for free? Because like I said, some of these methods, if someone didn't have insurance or had to pay full price out of pocket, could be pretty pricey. But fortunately, in the state of Minnesota, we have a really awesome family planning program. It's called the Minnesota Family Planning Program. And people who are young or on limited incomes are eligible to sign up and get a year of coverage where all of their birth control would be covered. In addition to that, it covers STI testing, annuals, pap smears, all of those good things that go into being a sexually healthy person are covered by Minnesota Family Planning, which is awesome. Any of those clinics that I talked about previously, you can absolutely go to, and they will help you sign up for Minnesota Family Planning. If you can't go to a clinic, you can sign up for it online, which is really great. Regardless, when anyone applies, they always get 1 month of provisional coverage. So that can be a really great time to deal with emergent sexual health needs and maybe get one of these long-term forms of birth control while they're reviewing the case to see if you qualify for a year of coverage. The last thing I want to talk about, and I know I said this is the last thing, but this is the real last thing I want to talk about, is if for some reason you couldn't make it to a clinic. It's just impossible for you to get there. There is an app that you can use. It's called Nurx, N-U-R-X. And you can use that app to get certain forms of birth control prescribed to you by a healthcare professional via the app. Clearly, you couldn't get any of the forms of birth control like the IUD or the implant or the shot because those need to be administered in person. But you could get the Nuvaring and a couple other forms of birth control like birth control pills through this app. And then once it's prescribed, it's delivered to your door, which is a really great option for folks who maybe can't make it to a clinic or live a little bit further outstate in Minnesota and it's just not reasonable to come to the Twin Cities. So thank you so much for tuning in and listening to this video. If you have any questions, please feel free to reach out. I am available by email at self@lssmn.org, or I'm sure if you reached out to the folks at Proof Alliance via their Instagram, they would get those questions to me too. Thanks so much, everyone. Bye.